I'm Joe Schwartz, and I direct McGill University's Office for Science and Society, where our mandate is to demystify science for the public and, of course, for everyone else, students, media, make sure that people are up to date on what happens in the world of science, and essentially separate sense from nonsense. As you can imagine, I kind of have a love affair with science. The word science comes from the Latin meaning knowledge. And much of that knowledge that we gain and talk about revolves around numbers. Science is based upon numbers. We're always measuring things, weighing things, analyzing statistics. And that is also the situation in the area that we're going to discuss here today, which is the area of vaccination. Numbers are very important when we're going to look at risk-benefit analysis. We're going to look at patterns of spread of the disease. So let's start with numbers. How about starting with the number 0? Because that is exactly the number of cases that we see these days in a terrible disease. What you're looking at here is the disease known as smallpox. It is absolutely horrific. But luckily, we have not seen a case of smallpox since 1977. The last person ever to suffer from this condition was Ali Malin in Somalia. It is a disease that has been completely wiped out. Why? Well, thanks to the phenomenon we know as vaccination, perhaps the most important technological feat ever to have been introduced in the history of medicine. It takes us all the way back to the late 1700s and Edward Jenner, a physician in England. And of course, England was ravaged by smallpox at that time, but he made an interesting observation. He noticed that milkmaids who worked with cows and sometimes came down with a disease called cowpox, characterized by pustules on the hand, never contracted smallpox. Well, he put 2 and 2 together and thought, gee, maybe somehow cowpox protects against smallpox. So he isolated a liquid from the pustules of cowpox victims and experimented, injected it into people to see whether or not, on subsequent exposure to the smallpox fluid from a patient who had suffered from this disease, whether or not that would cause the disease in someone who had been protected. Well, it turned out that he was correct. Protection was seen. He carried out a classic experiment, injecting a young boy with an extract of pustules from smallpox after he had been treated with cowpox extract, and he did not come down with smallpox. And thus was born vaccination. The word itself derives from Latin vacca, meaning cow, because the very first vaccination was based upon cowpox. And one would think that this would be immediately accepted. It wasn't. Cartoonists had a field day with this, suggesting that people would become cows if they were injected with this. But of course, pretty soon, science took foothold, and it was very clear that it worked, and Jenner, since that time, has been revered as the father of vaccination. Then things started to move pretty quickly. Louis Pasteur, who was a chemist in France, that's what he was. He was born and died a chemist, although the physicians have tried to steal him from us. And he was very, very interested in disease, and he developed a vaccine against rabies. And in fact, he showed that if someone was bitten by a rabid animal, he could be cured with the vaccination. And this was very dramatic when a young boy contracted rabies and was cured by Pasteur. Interestingly enough, this young boy eventually became the curator of the Pasteur Institute in Paris, and obviously dedicated his life to Pasteur and this advance in vaccination. But there were other diseases that had to be looked at. And some of these terrible diseases didn't spare anybody, whether you were young, old, or president of the United States. President Franklin Delano Roosevelt unfortunately suffered from polio. The people generally didn't know this because pictures were never taken of him, or almost never, in a wheelchair. And sometimes when he would stand giving speeches, he would hold on to a table or would have special braces made. Well, we don't have this kind of problem in the developed world anymore, thanks to Jonas Salk, who developed the classic vaccine, which is the polio vaccine. And up to that time, if someone came down with polio, they would be put into an iron lung, Well, imagine spending your life in one of these contraptions that had to sort of breathe for you. Well, the vaccine triumph ended the polio threat. Whooping cough, also a great success. We used to have about 300,000 cases a year. Now it's down to about 10,000. Measles, 1 million cases a year. Today, down to about 100. Although unfortunately, as we'll see in a few minutes, this is increasing because of the misinterpretation of some information that had been published in the scientific literature. Mumps also has been dramatically reduced. It has been reduced by a factor of 400 thanks to vaccination. And German measles or rubella, well, a very, very nasty disease. And back in the 1960s, about 20,000 babies were born deaf, blind, heart disease, mentally retarded because their mothers had been infected with the rubella virus. And when a vaccine was licensed back in 1969, it essentially solved the problem. Rubella has been reduced by a factor of about 200. That's pretty dramatic. So how do we explain the fact that there are still people out there who are scared of vaccines? In fact, they speak horrifically about what a vaccine can do. They link it to autism, and they refuse to have their children vaccinated for any reason. What is going on here? What's the background? Well, it's multifactorial. Some people are disenchanted with conventional medicine because conventional medicine, in fact, isn't perfect. It cannot solve all problems. And of course, sometimes there are long waiting lines. People are convinced that big pharma is controlling medicine, and everyone is interested only for the sake of their wallets and money rules, and that they're just producing these vaccines to make money with a callous disregard to the health of children. That's unfortunately the theory that many conspiracists have. But the most damaging view towards vaccination is offered by those people who link it to autism. Autism is a terrible disease. And of course, whenever you have a child that comes down with such a condition, you try to find reasons for what has caused this. And people jump to all kinds of conclusions. Well, it turns out that autism very often presents at the same stage in life where vaccines are given. And people jump to the cause and effect relationship from something that is just an association. Well, this was aided and abetted by a paper that was published in The Lancet. The Lancet is one of the prime medical publications in the world. It's a peer-reviewed publication, and one would hope that whatever is published there is pretty reliable. Well, back in 1989, a paper was published there by a British physician named Andrew Wakefield that suggested a link between autism and vaccine. And that took off like a bullet, and it stormed through the world. And all of a sudden, vaccination rates dropped, even though the paper turned out to be not very scientific. Some people even call it fraudulent. Indeed, the paper was eventually withdrawn after no link was found between the mumps, measles, rubella vaccine and autism by numerous studies carried out around the world. This is a very, very rare thing for a scientific publication to withdraw a paper. And it was withdrawn. In fact, Wakefield's license to practice medicine in England was taken away, and he became a pariah. He moved to the United States, and here, for some bizarre reason, he was regarded as a god. And his followers have never believed that the studies have shown that Wakefield was wrong. In fact, they claim that he's the scapegoat, that there is a conspiracy by big pharma, the medical and scientific establishment, to position him as a victim so that they can carry on giving out and selling their expensive but dangerous vaccines. This is a very dangerous view because science has shown very clearly that the risk of the vaccination is low. Indeed, there is no link to autism whatsoever, and it turns out that Wakefield had some personal reasons for writing that paper because he was actually carrying out some work to produce his own brand of vaccine that he was going to claim was superior to what was being sold. The problem is that so often facts are eclipsed by thrilling innuendo. That's what makes the news. Man bites dog is news. Dog bites man isn't. So if someone suggests that there's some kind of conspiracy to give people dangerous vaccines, the media picked that up even though it has no scientific foundation. Well, we've seen some of the consequences of Wakefield's work because vaccination rates have decreased and disease has increased. Published in New England of Medicine was a fascinating case of someone who contaminated a whole bunch of people who had not been vaccinated because she came back from, she had not been vaccinated herself, came back to the US not vaccinated, contaminated others, 34 confirmed cases, containment cost of $170,000, and stories like this spread and spread. Last year in Quebec, we had a major battle against a measles outbreak because vaccination rates have decreased, unfortunately, in some areas quite dramatically. Whooping cough, and I can talk about that with personal experience because I had whooping cough when I was young, and it is an absolutely terrible disease. We would never wish it on anyone. And yet there are children today who are developing whooping cough because they are not being vaccinated. Well, unfortunately, all of this has spilled over to the area of the flu vaccine as well. And people have become suspicious of it because they have linked it with Wakefield's innuendo and with some of the websites that claim that the flu vaccine is dangerous and it is not effective. Well, first thing to get straight is that anyone who refuses to take a flu vaccine is putting themselves and everyone around them at risk for this disease. It is not a pleasant ailment. The flu is not the common cold. It is not the sneezing, the relatively mild coughing, the fever. The flu is a very, very serious condition. It can affect the respiratory tract. You cough, and it's a very, very unpleasant cough. You have very high fever. You have aches and pains. Now, for most people, it kind of passes off after about a week of torture, but not for everybody. Indeed, the flu can be absolutely lethal, and we have evidence for that. This virus that we're looking at here gets into people's bodies, it infects cells, and it ravages them, causing all kinds of symptoms, and unfortunately, sometimes resulting in death. Back in 1918, the biggest flu outbreak ever in history occurred around the world. It was called the Spanish flu because that's where it started, and estimates are of a minimum of 20 million people who perished from the flu back then. And that was not the only time. In fact, quite recently, in 1968, the Hong Kong flu spread around. 1 million people died from the Hong Kong flu. Globally, as many as 500,000 people die every year from the flu. So it's not just an innocuous condition. In fact, if I were to ask the question, what do you think killed more people in Quebec, let's say last year, the flu or breast cancer? Well, you'd be surprised because the answer is the flu. So we do need to do something about this. And there is help. Now, perhaps the simplest way to help prevent the spread of the flu is simplicity itself. It is washing hands. The more often you wash your hands, the less likely the flu is to spread. The flu virus is viable for about 24 to 48 hours outside of the body. So if someone has the flu and touches their face and then touches a doorknob or touches a button in the elevator, and then you happen to touch that within 24 to 48 hours and then touch your eyes or your nose, presto, the virus enters your body. This is why it is so important to wash hands very, very often. And soap and water are perfectly good enough to do that. Frequency is really what matters. But the most effective way to cut down on the number of deaths that we see around the world from the flu is vaccination. Well, the flu vaccine has a long history of use. It has been in common use now for about 20 years. And of course, there are several questions that arise as soon as we introduce the idea of a flu vaccine. The first question is, how effective is it? What is the chance that I'm going to get the flu after I've had the vaccine? The answer to this is not simple. And depending on which scientific paper you look at and which expert you listen to, it ranges anywhere from about 25 to 75%. Now, even at the lowest level of 25%, that's still significant when you consider the number of people who die from the flu. Well, why do we have this range of effectiveness? Because the vaccine is not equally effective in all people. It depends on many things. It depends on age. It depends on health status. If you take someone, for example, who's healthy and who is middle-aged and give them a vaccine, the chance of protection is very high. In fact, it can be as much as 90% reduction in risk of catching the disease. In a healthy person, because their immune system is very adept to forming antibodies in response to the viral invasion. If someone is very young, also the vaccine is very effective because they also have a very, very vigorous immune system. They may not enjoy getting the vaccine, but it can be life-protecting. On the other hand, when we're talking about our more senior citizens, well, here the vaccine is not quite as effective. Why? Because their immune system is not as in tune and doesn't generate as many antibodies as when they were younger. But just because it isn't as effective doesn't mean that it isn't effective at all, obviously. Because we've seen that in the elderly population, death rates have gone down very significantly when a large percentage of people are vaccinated. This is especially important in healthcare workers. Now, of course, it is true that healthcare workers are generally middle-aged, healthy people, and their chance of dying from the flu is minimal. But they, of course, are in contact with many people who are greatly at risk. People who are diabetics, people who have had surgery, people who are undergoing chemotherapy. They're all at risk because their immune system is impaired. So any healthcare worker who is in contact with ill people or hospitalized patients can transmit the disease, in fact, even if they don't contract the disease themselves. So it's critical, obviously, to wash hands frequently. And we have seen the studies that in healthcare workers, when they are vaccinated, the number of deaths among patients in institutions and senior homes and in hospitals goes down very, very significantly. So it isn't only a question of, gee, is it going to protect me? It's a question of, is it going to protect everyone around me? Well, to give you an even bigger boost for motivation in terms of getting the vaccine, there are other benefits that can be had. And believe it or not, the heart is involved. It turns out that when we look at what happens to people in the year after they have been vaccinated for the flu, their risk of developing cardiovascular disease goes down. Well, how can this be? What's the possible connection? And there is a rationale here, because the flu is in fact an inflammatory condition. Tissues inside the body become inflamed. And we also know that inflammation is one of the hallmarks of coronary disease, because if you already have a deposit in a coronary artery, that is one of the arteries that feeds the heart muscle, and there's the buildup of plaque deposits in that artery, inflammation can cause that plaque to burst, a blood clot forms, and then you have the makings of a heart attack, you have the makings of a stroke. So it is in fact logical that if you reduce the risk of inflammation by having the flu vaccine, you will reduce the risk of heart disease in the year subsequent to having the flu shot. Well, what is the risk? There's no medical intervention that is ever carried out that does not come with some degree of risk. It is always a question of weighing the risk against the benefit. So what do we look at when we examine risks of the flu? First of all, possibility of allergic reaction. This is very real, especially in people who have an allergy to eggs, because the virus that is used to create the vaccine is grown in eggs. So of course these people have to be told to stay away from the vaccine if they are documented to have an egg allergy. But that is a very, very rare situation. In even fewer cases, there can be an allergy to some of the ingredients in the vaccine, but that is virtually never seen, but it's a theoretical possibility. It is possible to develop minor flu-like symptoms after the vaccine, aches and pains, and perhaps even a fever for about 24 hours. But that's still a lot better than struggling with the flu full-blown for about a week. It is impossible to catch the flu from the vaccine. The flu is made with what is called attenuated virus. It is not a living entity that can cause the disease. So that is not possible. But you can get minor symptoms that seem to be like the flu, but as I said, they pass on within about 24 hours. Perhaps the biggest concern that has been raised is about Guillain-Barré syndrome, which is a neurological disease that can actually lead to paralysis. Well, when one peruses the scientific literature, see that this is just not well founded. In fact, it turns out that your risk of getting Guillain-Barré as a complication of the flu is greater than the risk of developing this awful condition from the vaccine. So Guillain-Barré really should not play a role in determining whether or not one gets the flu vaccine. So those are the risks that have to be considered. But of course, what we need to do is weigh that risk against the benefit. There's nothing in life that we do that comes with no risk. I drove here today to do this, and I made the decision that the benefits outweigh the risks. There were risks coming here. Anytime you get into a car, there is a risk. It is the question of weighing the risk against the benefit. So let's not throw out the baby with the bathwater. Just because you hear some occasional comment about someone having an adverse reaction to the vaccine, that doesn't mean that we should stop using it. Because when you look at the scientific literature, you listen to the experts, you find out that the benefits outweigh the risks. And it is a key to know who to listen to. In science, we go by what we call the peer-reviewed literature. That's the altar at which we worship. That's what we embrace. Now, it's not to suggest that peer review is perfect. After all, Andrew Wakefield's paper originally appeared in The Lancet. But science is a self-correcting discipline, and generally it doesn't take very long for self-correction to appear. Today we know that that paper was faulty, and Wakefield has been essentially put out of service, at least as far as a practicing physician goes, although he's still out there circulating, giving lectures on how he has been made into a scapegoat. So we go by the scientific literature. We don't listen to actors and actresses, no matter how pretty or good looking they are and how much of a following they have. Jenny McCarthy, former Playboy bunny, which obviously classifies anyone as a top-notch scientist, goes around the world talking about the dangers of vaccine. She has no scientific background whatsoever. We don't go listen to reporters on late-night TV shows. Bill Maher may be a very clever comedian, but when he tells you that you're an idiot if you get a flu shot, well, what can I say? I don't use such words, but if I did, I would use them on him. We don't listen to osteopaths who have websites that tell us that we should stay away from the flu because baking soda is a potential treatment that's equivalent. This is absolute nonsense. The protection that we have against the flu is washing hands. The protection we have against the flu is getting a vaccine, not by listening to this kind of silliness. We look for the evidence. And the evidence is that the benefits of getting a flu vaccine outweigh the risks. And it is perhaps more important for healthcare workers than for anyone else because they are in a position where they can make others ill. And of course, the first rule of medicine is, above all, do not make someone ill. Make sure that whatever you're doing is the right thing to do. Well, I think that the right thing to do is to get the flu shot and not get the flu. And that's why I'm going to do that myself. And everyone in my office is going to get the flu shot as well. And I hope that all of you listening to this will think this thoroughly and weigh the risks and the benefits.